Hi there, yes, my name is Dan Wohlgelernter. I'm a cardiologist, trained at Yale University School of Medicine in New Haven, Connecticut, and I've been a cardiologist here in Santa Monica, California for the last 30 years.
Hi, good morning. I'm Dr. Simone Gold. I'm a board-certified emergency physician. I'm also an attorney. Please don't hold that against me. And I practice on the front lines, whether or not there's a pandemic.
Dr. Dan, why have you decided to speak out?
Well, I've decided to speak out because I think that we're dealing with a tragic situation where the scientific process has been violated. Studies have been published that had not been adequately vetted and should not have been published, and those studies were used to terminate further evaluations of hydroxychloroquine. I've decided to speak out because the political interference in the physician decision-making process is objectionable and should not be allowed to continue. There are lessons to be learned from this pandemic on many levels. We've spoken about the dangers and the irrationality of the lockdown process. We've spoken about the violation of the scientific purity of investigation. We've spoken about media presentations and misrepresentations of data. This is injurious to the health of our population now, and I don't want to see this replicated in the future. I think as physicians we have a moral responsibility to protect our patients, to protect the science behind our medical decisions, and to prevent intrusions into the purity of the scientific process by outside forces that may have bad intent. And it's important to speak out. It's a moral imperative for us to speak out and to protect our patients and to protect our profession.
Dr. Gold, why did you decide to speak out?
So I decided to speak out for one very specific reason. That was I was actually presented with a definite COVID positive patient, and I prescribed hydroxychloroquine and zinc because I was very up on the literature on this, and I got severely reprimanded for it. And I also had received a letter from the state board threatening all doctors, I was just one, with potential investigation into me for unprofessional conduct if I was to prescribe hydroxychloroquine. This was so shocking to me. It had never happened where the government told a physician if they had a right or not a right to prescribe an FDA-approved medication. I mean, that was just a sui generis event that took me by surprise. And I thought to myself, if doctors don't speak up, we're really all lost.
Let me add one other thing, if I might.
Yep.
So I think it's important in terms of people's perspective about the impact of COVID that they understand that the data now show that 99.7% of people infected with COVID will survive. 0.3% die. And the vast majority of those people who die, as we've discussed, are the elderly, the frail, those at end of life. And that's not to say that we don't care about those deaths. On the contrary, we feel that many of those deaths could have been and should have been prevented had the proper precautions been taken, as were taken in the state of Florida, in contrast to how things were handled in the state of New York, state of New Jersey, state of Pennsylvania, where the nursing homes were not protected and were forced to take people who were actively infected. What we needed to do was not lock down all of society, not shut down schools, not shut down all businesses. We needed to protect the elderly, particularly the elderly in the nursing homes. It's a small segment of our population. We could have allowed the rest of the population to continue with their lives, take adequate precautions, but not be completely shut down. The cost of the shutdown, in terms of the physical, emotional, and psychological health of people, is enormous. We've only seen the tip of the iceberg of people who have been shut in, who've lost their businesses, who are facing depression, who are facing issues of mental health because of the consequences. This should never happen again. If we ever face this kind of situation again, we need to learn the lessons from the mistakes in policy that were implemented.
So it recently came out that the coronavirus isn't as contagious as they thought, especially for asymptomatic carriers. Is this big news in the medical field? Have you guys known this? And what does that really mean for, the precautions they've been taking?
Whenever you review the CDC studies, you can see that it wasn't affecting young people. This has been, I think, a tragedy that we've locked down our young people. Again, this data is widely available to anybody who wants to search it out. CDC.gov, you can see people based on their ages, and it hardly affects teenagers and youths under 20, 30, 40. Really, under age 60, it does not have a higher lethality rate than common influenza. So I was not surprised.
As Dr. Gold said, I think that the focus should have been on protecting the high-risk population. And we knew from the data that had come out from China and from Italy and from France that the people at risk were the elderly and frail, people immunocompromised. As Dr. Gold said, young people had very little risk from this infection. They rarely got ill from it. So it was not a good decision to shut down schools, to shut down all businesses. And it certainly was not a good decision to send actively infected coronavirus patients to nursing homes. So the strategy was inverted. We should have protected the people in the nursing homes and given those homes more resources to protect the people at risk. And the low-risk population should have been allowed to live their lives. We could have had some precautions in terms of social distancing and masks perhaps, but to close down the entire society when in fact it's just a small segment of that society that's at risk, I think was a tragic mistake.
I work in the emergency department, so I see people of all ages. And my heart would sink whenever I would see a nursing home patient, because I knew right behind that nursing home patient, there's 5 more and 10 more behind that one. It flies through the nursing homes. First of all, they're immune compromised. You cannot be a nursing home patient unless you have a skilled nursing need. These are just not ordinary older people. These are people that have at least one pretty serious medical condition. Many of them have 3 or 4 serious medical conditions. Obviously, this is going to fly through the nursing homes, and they can't fight it. So when I, as an emergency physician, would see people with COVID-19, the ones that got really sick are the nursing home patients. Sometimes a person who wasn't in a nursing home was also sick, very sick, but I almost never see a younger person or a healthy person that was sick enough that had to be even hospitalized, let alone severely ill and needing something like intubation. And always in life there's limited resources, and the resources need to go where they can be most useful. What we did is we spread all our resources out amongst society at large. That, I think, was criminal and immoral. We needed to focus the resources on the people that needed it, our nursing home patients. As a specific example that I know off the top of my head, in Pennsylvania, the average age of the person who died from COVID-19 was 79. At the same time, the life expectancy was 78.7. So, of course, all deaths are tragic. All of us have parents whom we love. However, it's in a different category when a person who's past life expectancy passes versus a person who's 20 and passes. So when the average person sees these numbers that are calculated every day, 100,000 Americans have died, they're not able to put that in context because the media is not giving the context. Do you know how many Americans die every year? The average American doesn't know. The question is, how many more people died due to COVID-19 that were not going to already die, let's say, within this year? That number is very low. And I think there's going to have to be some reckoning when this is all over, how we really harmed and killed nursing home patients.
Yeah, the data certainly were known. We knew this as early as February from China, from Italy, that it was the elderly and frail who were most at risk. So why did Governor Cuomo and his health commissioner force the nursing homes to take patients? Well, it was part of the overall panic that occurred not just among society, but in the healthcare industry. The hospitals in New York and throughout the country were afraid that they would be overwhelmed with patients and that they wouldn't have sufficient capacity. And they wanted to offload patients who were no longer requiring inpatient, high-intensity care. And they said, we need to let those people go out of the hospital. And where can you send them? Well, there were places in New York where they could have sent them. The Javits Center, which had been equipped, the Navy ship Comfort that had been sent, to the New York Harbor. Instead, they were sent to nursing homes, where it created massive death. This was a tragic mistake. just absolute negligence in terms of decision making.
Yeah, so the Comfort and the Java Center were shockingly empty. They were almost completely empty, which was amazing. The question of why Governor Cuomo did this, it's very unpleasant to speculate. But one thing that's for sure is it was absolutely known when he made the decision to let the patients go back to the nursing homes. It was 100% known. I understand looking back, people will wonder, was it known? There's no question. You can go back and you can look at the dates of these things. It was absolutely known that it was risky to send the nursing home patients back. The health commissioner of Pennsylvania really had an egregious situation where she took her own mother out of an assisted living facility, but she told the rest of the state that it was perfectly safe to leave your grandparent in an assisted living facility. That's just egregious. There's no question that it was known at the time. I don't know why this was the plan. People always wonder why the deaths were so high in New York. There's no question that the nursing home deaths put them over the top. No question. And a fact that's often missed is that patients that got sick in the nursing home were often sent to the hospital and died. Those do not even count as COVID deaths attributable to the nursing home. That doesn't even count. So whatever the number is, it's higher.
You have an interesting contrast between the state of New York and the state of Florida. In the state of New York, the nursing homes were not protected. They were not given adequate PPE, protective equipment. They were not given adequate resources, and they were forced by the governor, by the health commissioner, by the mayor of New York City to accept people who were discharged from the hospital and were still actively infected with coronavirus. And guess what happened? Just as what you would predict would have happened, you had thousands of deaths. It's estimated that as many as 40, even 50% of the deaths in New York were nursing home patients. This was preventable. The proof of it is the state of Florida, where the Governor DeSantis, said, let's protect the nursing homes. And his health commissioner said, let's work on protecting the nursing homes, not allowing visitors, checking everyone who comes in to make certain that there's no evidence of infection, giving them adequate resources, and certainly not allowing any people with active infection to go into the nursing homes. So the mortality rate in the nursing homes in Florida was small. And Florida, as most people know, has a large percentage of elderly people, not just in nursing homes, but throughout the society. You have all the snowbirds who come down from, the Northeast. So it shows you, with good policies, with rational thinking, you can protect people, and we could have had a much lower death rate and death count in this country had people followed the policies that were used in the state of Florida.
And there is a lot of talk going around now about hydroxychloroquine. People are saying it's very dangerous. The news is really hammering it. Is that, Dr. Dan, is hydroxychloroquine something that you think is dangerous? Is it something you've prescribed to patients before?
I've prescribed it. I've also recommended it to people, and I've had conversations with physicians literally around the globe, in Israel and Italy and England and the East Coast of the United States. And I've read the literature extensively. So hydroxychloroquine definitely has a role. That role is specific. It's an antiviral agent that is effective in the early stages of infection. When used in that context, it is effective and it is safe. Unfortunately, there have been studies that have looked at hydroxychloroquine, but have looked at it in the wrong context. They've looked at it in severely, critically ill people in the hospital setting. At that point, the antiviral isn't effective because you've gone beyond viral infection to an immune-mediated, widespread inflammatory reaction. So that was the wrong population to look at hydroxychloroquine in. And that kind of study, that sabotages the whole story about hydroxychloroquine. Those studies, I'm not quite certain why they were designed that way, but it was obvious that hydroxychloroquine would fail in that context. The hydroxychloroquine has been reported to have heart toxicity, and as a cardiologist, I'm intimately aware of this literature and I'm familiar with hydroxychloroquine. And the study that was most specific in looking at the cardiac issues, specifically with rhythm abnormalities, was a study done in the East Coast in the New York area, where they looked at 200 patients and carefully monitored their EKGs and looked for arrhythmias, and they found no serious arrhythmias in any of those patients. Some of the reports about danger to the heart and dangerous effects of hydroxychloroquine are based on misinterpretation of data or on faulty data.
Interesting. Yeah, we did see the World Health Organization ordered countries to stop using hydroxychloroquine recently, and they've also stopped trial testing on it as well. Was this decision based on those studies from Lancet, New England Journal of Medicine, and JAMA?
Yes, so the World Health Organization stopped the hydroxychloroquine trials based specifically on the faulty studies that were printed in the Lancet and printed in the New England Journal of Medicine. Also, the European Union stopped it, and it was headlines all across the world that we should stop using it. I do want to clarify for the audience that they did restart the trials once the Lancet and New England Journal of Medicine retracted those faulty studies. However, it's not so easy to just, restart a trial, right? You have all these patients, they were in the trial, it had to stop and start and gather new patients. And the damage has certainly been done. And in addition to those studies, there's been so much negative press about hydroxychloroquine that it's actually difficult to even enroll patients in hydroxychloroquine studies. That's been well documented. There's a professor at Columbia who said, it's hard for me to even get patients in the study because they hear about hydroxychloroquine and they think it's so negative. And I always want to remind people, this is an FDA-approved drug for 65 years. It's generic, it's cheap, it's widely available. We give it to pregnant women, we give it to breastfeeding women, we give it to elderly patients, we give it to patients who are immune compromised. Most of those patients are on it for decades. There was never controversy about hydroxychloroquine right up until March 20th, 2020. So I would look at the studies before then. The early studies before Trump said he kind of liked the drug were uncontroversial. From China and from France, it looked promising. I don't know what the final data will show. However, I do find that the data after Trump thought it was possibly helpful is suspect.
Absolutely. And a lot of people are saying that the JAMA study is the most flawed out of the three. And why is it so controversial? And can you kind of touch on how they collected the data and why it was a little skewed?
Yeah, let me just back up first. On the Lancet study and the New England Journal of Medicine study, both were retracted. And I really want to emphasize that's a very rare thing for a world-famous journal to do. I mean, to be published in the Lancet and to be published in the New England Journal of Medicine is no easy feat. It's the world-class editors and journal, and people all over the world listen to these journals. There's a handful of journals in that category. Those are probably the number 1 and 2. So to have them do a retraction was a major story, which is why you heard about it in the headlines. The reason their study was retracted is the data that went into those studies could not be independently verified. You can draw what conclusions from that as you will. Was the data even gathered? Was the data faulty? Was it fabricated? We don't know because we asked the company that provided the data, a company called Surgisphere, which has been quite secretive, to reveal their data, and they have absolutely refused. Because they wouldn't reveal their data, those studies had to be retracted by the journals. That's the problem with those. In addition, a story that hasn't been discussed really in the media is a third world premier class medical journal, Journal of the American Medical Association, known as JAMA, also is severely flawed. And there are a number of flaws with this. The first major flaw in the JAMA study is what I would call pseudo-randomization. To do an effective medical study, you have to randomize the patients into different groups that have this character and that character. And the point being that the groups should be generally similar so that you know if the drug actually made the difference. If you give the drug here but not here, it doesn't really help if the groups themselves are pretty different, right? So you kind of make them even in terms of age or risk factors, heart disease, etc. When you look at the study itself, as it's printed right now in JAMA, your listeners, I encourage you, viewers, to go and look this up yourself. On page 7 of the study, you can look and see that the groups are not equal. The higher dose group is 7 years older. They have almost 18% heart disease. Those are just 2 of the differences. The other group is 7 years younger and has 0% heart disease. And there's a number of these flaws that are different in the 2 groups. By itself, that's cherry picking of patients that would make any data that comes from such a study suspect. So I want to be clear that the JAMA study used not exactly hydroxychloroquine. They used a drug called chloroquine, which is really a precursor to hydroxychloroquine. Sometimes we use those names interchangeably, but in America we only use hydroxychloroquine. The JAMA study was in Brazil. They used chloroquine. The lethal dose of chloroquine has been well established for more than 30 years. In 1988, New England Journal of Medicine, again one of the world premier journals, established and everyone accepts that the lethal dose of chloroquine is 5 grams. Well, the JAMA study had 2 groups. In the high dose chloroquine group, they gave them 1.2 grams a day, which means by the fourth day, they had almost 5 grams. Now, most of us think of a drug as going through your system kind of quickly, and you're like, well, it's been 4 or 5 days. That's not the case with chloroquine and hydroxychloroquine. Hydroxychloroquine and chloroquine sit in your body for a very long time, at least a month, perhaps 2 months, somewhere between 30 and 60 days is its half-life. So to give somebody 4.8 grams in 4 days is a very large dose. People would often possibly call that a lethal dose. The study went on for 10 days, which meant that the people in that group got 12 grams. Again, New England Journal of Medicine, 1988, established 5 grams as a lethal dose. If you don't think it's lethal, you would at least say it's very toxic, and patients would be expected to have a lot of neurologic symptoms or cardiovascular symptoms. You would certainly expect them to be vomiting. Mind you, these are elderly, critically ill patients that are intubated or severe respiratory distress. You don't want these people to be vomiting. That's hugely a risk factor. It's not just my speculation or the science data that says this was a very high toxic dose. So many patients died in the high dose group that they halted that study early. They quit the high dose group because so many patients died. That's extremely dramatic for a scientific study. It's very unusual for a study to have given such a large dose of a medication because all scientific studies that involve human subjects have to be overseen by an ethics board. The scientists that did this study presented the paper to JAMA saying that they went through an ethics board. However, that's in doubt. The Brazilian Ministry of Justice is actually investigating. There's actually no proof that there actually was an ethics board. I can't speak to if they absolutely had it or not, but what I can say is there's no proof that they had it. They normally have a certain committee number that's stamped on the paperwork, and they don't have that. We have written to them and tried to get it, and there has been no response on that. So the Ministry of Justice is actually investigating the deaths of all those patients who died in the high-dose chloroquine group.
Dr. Dan, in your opinion, why do you think hydroxychloroquine has become so politicized after hearing all this and seeing how the media has been kind of portraying it?
Well, I think one of the serious casualties of the COVID pandemic has been scientific truth. We rely on the scientific process to be pure and untainted by political influence. The fact that, as Dr. Gold said, 2 of the world's most prestigious journals, Lancet and the New England Journal of Medicine, published studies hastily, without adequate peer review, and studies that were based on data that had not, where there was no transparency, that creates widespread skepticism about the reliability of medical journals to give information that can be trusted. And we're going to need to look into that whole process and to reform the process of publication so that we never see that kind of violation of scientific truth. Now, why did this become politicized? The fact is that President Trump first mentioned hydroxychloroquine and advocated for its use as a non-physician in mid-March. But we had data from China and from France well before that, in February, showing a significant beneficial impact of hydroxychloroquine. Yet, you saw physicians, politicians, journalists saying that hydroxychloroquine is all hype and it's all due to the president pushing it. And that's revisionist history. The fact is there was a great deal of excitement in the medical community internationally a month before President Trump ever mentioned it because of the data reported from China and from Dr. Raoult in France. And it's sad that people used whatever political animosity they had towards the president to attack a medication that in fact had helped many people with coronavirus and could have helped many more had its reputation not been so sullied by political accusations and by poorly designed studies and by medical journals allowing publications that were negative as far as their conclusions, publications that never should have reached print because they hadn't been adequately vetted.
Interesting.
I got asked a lot of questions about the VA study of hydroxychloroquine, and my immediate instinct is to wonder why hydroxychloroquine keeps getting studied at the later stages of the disease. I can't emphasize enough that the mechanism of action of a drug and the pathophysiology of a disease is the number one factor when you're structuring a scientific study. So the disease early in the course is all about viral replication. How much virus can be produced and how quickly. That's a problem in the early setting. In the late setting, the problem is your body's over-response trying to cure itself, and that's called a cytokine storm. And in that setting, that affects all of your organs, including your lungs, failing. In the first group, which is the early group, you would like a drug that is very good at preventing the viral replication, right? That's what hydroxychloroquine with zinc is very, very good at. So I was always a bit confused why we kept getting study after study after study about hydroxychloroquine being studied in the late stage disease population, and kind of like it doesn't snow in August, it wasn't working very well. So to me, the VA study, the Lancet study, JAMA, all of those studies, I'm not that surprised because I already know it doesn't snow in August. I'm waiting to see the data about hydroxychloroquine and zinc, how well it works early on. Mechanism of action would indicate it would work well, and before the hydroxychloroquine got politicized, the preliminary data that we have from China and from France was very promising.
As Dr. Gold mentioned, hydroxychloroquine and chloroquine have been around since the 1950s. Azithromycin, which is an adjuvant agent used with hydroxychloroquine, has been around for 30 years. These agents have been shown to be safe and to be effective. And again, you needed to understand which context it worked in. It wasn't going to work in the critically ill, hospitalized patients on ventilators with multi-organ system failure. That was not what it should have been used for. It works in early stage where the antiviral effect can terminate the infection and prevent people from getting critically ill. And it's sad that many people to this day have been deprived of the potentially beneficial use of an agent that in fact is safe and that is inexpensive and that's widely available.
Definitely. Dr. Gold, what is your message to the media?
My message to the media is, I understand that you have a point of view, and God bless you, and you can say it. Free speech is very important. But don't have an opinion on the science of a medication. Think of your own family and your own loved ones, and relegate to the scientists the purity of the scientific result. Because one day you could suffer the harm of having polluted that process. My message to the scientists is, I understand that there's a lot of pressure out there, maybe from big pharmaceutical companies or journal editors, to come to a specific result. I implore scientists to stand the line. If us scientists don't stand the line and hold for truth and accuracy, nobody will, certainly not the media, certainly not politicians. I'm very distressed on two levels about the JAMA study. The first level is that the scientists who ran that actual study, it doesn't seem as though it was done in the correct scientific manner. The other part I'm upset about is the journal itself, which I don't think vetted it in the manner that a world-class medical journal is supposed to vet it. So my message to the scientists and the editors is, please ignore the media and please ignore the politicians. Please focus on the science. All of humanity depends upon you doing that.
Perfect. That was awesome.